In this segment, we want to talk about peg tube care or feeding tube care and what's called a Mickey. You're going to be using the feeding tube at least 3 times a day. There's many different ways of providing nutrition through the feeding tube. Again, I would talk to the nutritionist or the nurse, clinician, or whoever you're working with about alternative ways of using the feeding tube. In my case, we were doing what's called bolus feedings, where I would actually pour the feeding material, the Jevity, through a syringe into the feeding tube. So just some thoughts on that whole process. If you're the one that's going to be doing this, then you have to find a comfortable location to do it, where the pals is comfortable and you as the caregiver or who's going to be working with the feeding tube is facing the pals. I used a bridge chair and was able to face her directly when she was in a comfortable chair. You need a small table next to the chairs with a towel on it. And the towel, the pals may need a washcloth to control their own saliva eventually. The feeding tube items are going to be wet, so you want a towel there just as a way of keeping the area clean. What I did is I stored everything in a measuring cup. So I had a big measuring cup, and I kept the extension tubes and the syringe and the shake bottle that I used for medicine and everything in this one measuring cup to keep everything together. There was a washcloth I used on the sink, which I laid out on the sink area in the bathroom, so that after I used the feeding tube I could wash all of the extension tube and the syringes and the shake bottles and everything else that I used, and let them dry on a towel next to the sink. Again, you need to talk to the nutritionist about adjusting calories through the tube versus whatever the pals is able to eat. Eventually, of course, all nutrition is going to be going through the tube, so you need to determine with the proper nutritionist how much material, the Jevity in the case of what I was using, plus water, because hydration is a real big problem because the patient, the pals, is not swallowing water, so you have to figure out how much water you're going to have to include in order with the feeding tube material. And a nutritionist will help you do that and lay that all out for you. As soon as possible, one of the things you should do is get changed. Get the peg tube, the normal feeding tube, which is a long extension tube, changed to what's called a Mickey. And this is the brochure that comes in the box. A lot of people I find aren't aware of this. It's primarily used in pediatric environments, but many hospitals now are aware of changing over to a Mickey tube as soon as possible as an adult. The Mickey tube is so much better, so much easier, so much more comfortable for the pals, and so much easier for you as a caregiver. I can't begin to tell you how much better it is. So normally it takes, you have to have the initial feeding tube in for a period of about 3 months, and after 3 months they can change it over to a peg tube. And the changeover procedure is easy. It's 10 minutes in an outpatient office. It's not a surgical procedure or anything like that. There's no anesthetic involved. Very easy, very simple to do. And normally you get this Mickey tube changed every 3 months. But the medical parts of it, obviously you need to talk to the medical people about. The purpose of me telling you about it is to know about a Mickey, to be aware that there is a Mickey feeding tube available, and to get it changed. Get the normal feeding tube changed over to a Mickey as soon as possible. It'll make your life easier, and it'll make the pal's life so much better. It's such a more comfortable way to deal with a feeding tube.